Hello, everyone, and welcome to another audio podcast. In this series, around the ZtormTronix case review v.2. This is an audio podcast on leadership and management in healthcare today, and what it should mean in pathology. This is a storm Logistics production, and uh, and this overview is going to be in context to works that have been put put forward works that have been put forward for sort of peer review in relating to the remit around the British Blood and Transfusion Society, the BBTS, wherein they have a journal that relates publications on aspects of professional practice. So I thought I'd do this audio podcast around this, providing a sort of a synopsis or a basis around this particular topic. Once again, this is the Shientist. So a bit of background. So laboratory medicine and pathology is dynamic and challenging, thus requiring interactivity and inspiring role models, leaders, and managers. In today's ever-changing and demanding healthcare environment, identifying and developing scientists, leaders, and managers is one of the greatest challenges faced by the scientific healthcare profession. Scientific healthcare profession. The concept of leadership and management is complex and a multidimensional phenomenon. Research conducted over a century concludes that although both concepts, thus leadership and management, are involved through everyday healthcare practices, in ever-advancing disciplines across pathology, the accepted definitions or theories are not integrated between scientific practice and healthcare research. And so integrative practices in the sciences retrospectively have been either sidelined and or non-priority owing to the volume of tests and investigations that enter pathology departments. So the objectives around this work were the following. The objective of this particular work was to highlight what leadership and management should mean in pathology. Additionally, this work look to sort of make some specific recommendations regarding continual professional development. So a little bit around knowing healthcare through research practices. So it was in early 2022 when the Institute of Biomedical Sciences, the IBMS, launched an update surrounding corporate strategy, and wherein part of the update included a mission to commission academic research into the benefits that scientific workforce contributes to healthcare and science. In addition, with professional affiliated bodies, the Institute of Biomedical Sciences informed that it would seek to promote common areas of research through commissioning joint efforts. Historically, the nature of scientific practices across pathology has needed scientists, or has required scientists who are keen to immerse beyond standard operating procedures and apply evidence-based practices, linking research. And knowing laboratory practices is to also apply and link the evidence. So this way of work-based developing is developing. This way of work-based developing is still to be encouraged, since routine scientific practices retrospectively, whether knowingly or unknowingly, do not openly encourage healthcare through research practices. This is important to appreciate because because the nature of scientific practices help advance specific areas of practices within the profession, where routine scientific practices alone lead to inertia. So a little bit about leadership and transfusion practices. Where this work is concerned, a broader understanding of renal health or kidney health in the general population is required in order to ensure that the best use of blood products are provided to patients who have long-term conditions or chronic illnesses. But at the same time, being a leader in this profession also requires scientists to demonstrate integrity and have those important constructive communication constructive communications with multidisciplinary colleagues and doctors making transfusion requests, so that they know when it is safe or not safe to potentially transfuse patients because of ever aging or living longer population. There are some very adept scientists who have a lot of knowledge and understanding in key areas of laboratory medicine, yet are, number one, either not offered opportunity to implement knowledge base, i.e., for example, unable to demonstrate leadership quality, and or two, practice management, for example, where experienced managers are not identifying leaders in areas of laboratory practice or laboratory medicine who demonstrate work ethic, again going beyond standard operating procedures and apply evidence-based practices linking research. And so there is still a need to appreciate what further aspects of care are required for patients with long-term conditions, LTCs, and chronic illnesses, CIs, in the broader sense, and where it would be pertinent to highlight what specific practices would help transfusion care guidelines and for specific areas of laboratory medicines. So, in context, it's also important to know about how to step out of inertia. So having a good knowledge base linked with good leadership and or management is important, because this also embraces shared decision processes, allowing scientists to be welcomed as healthcare collaborators. Leadership, perhaps more so than management, is also knowing when and how patients may benefit with alternative treatments or treatment pathways. So there needs to be good examples in practice, so colleagues can gain firsthand on what works well, irrespective of grade. Today, this is still an issue. For example, there are lower grade colleagues who have spent time in various areas of healthcare and learning how practice should be enhanced and better corroborated, yet experience can be undervalued in a larger workforce. So what could be done better? An evidence-based recommendation for change in practice could also include robust pathway to encourage and develop future scientist leaders and managers, thus bringing laboratory medicine and pathology more into the forefront. There needs to be more opportunity for scientists to train frontline health professionals, especially to fulfill blood component requests. One example might be where renal patients, kidney patients, or patients who may be suspect or high risk for renal insufficiency. So the idea ultimately is to ensure safe transfusion care and practice and prompt the concept of evidence-based practices as part of routine pathology practices. Scientists should be equipped with skill base to have multidisciplinary discussions relating latest evidence in patient care. There needs to be a step or process whereby scientists are part of more involved multidisciplinary team practices. And so, in context with leadership a science practice, and evidence-based healthcare example. So there is a continuous requirement to have leadership through laboratory medicine and pathology. Management alone does not allow pathway in practice for scientist colleagues to follow. With a scientific premise, it has been over a decade, and relating academic and healthcare research, healthcare practices, one initiative continues to highlight integrative practices in line with evidence base. So founded in 2009, the Renal Patient Support Group, the RPSG, is an evidence-based support group for those suffering with chronic kidney disease or CKD. The RPSG now has close to 10,000 members, and partnered with the Kidney Disease and Renal Support Group, or KDARS for Kids group, founded in 2014, which has close to 2,000 members internationally. So the overall summary in this context is scientists are needed who can contribute through multidisciplinary team and implementing evidence-based practices, thus shifting the paradigm of leadership and management wherein profession can achieve practice excellence through evidence-centered repertoires in line with routine scientific practices. This has been your host, the Shientist, in this audio podcast around leadership and management in healthcare today, and what should it mean in pathology. It's been an audio podcast in the series, the ZtormTronix case review v.2, and this has been another Storm Robotics production. Thank you for taking the time to check this out.